Good morning, Cavaliers. Welcome, students, teachers, and guests. I am Vicki Adamson, proud principal of John F. Kennedy High School. That's all right, I love it. I am honored to introduce our esteemed keynote speaker who is returning home to John F. Kennedy High School, Dr. Rahul Gupta, Director of the White House Office of National Drug Control Policy. I also welcome the Honorable Aruna Miller, the Lieutenant Governor of Maryland. And also from the state of Maryland, Emily Keller, Special Secretary of Opioid Response. Members of the County Council, I believe we have Don Lutke. And our own Natalie Fanny Gonzalez. Members of the Board of Education, Brenda Wolf, who's in the audience. And Lynn Harris, who is here on stage with me. I would also like to welcome Dr. Peter Moran, MCPS Chief of Schools. Dr. James Bridgers, Jr., Department of Health and Human Services. Dr. Keisha Davis, Montgomery County Health Officer. Laura Mitchell, Montgomery Goes Purple. And I also want to welcome all of our other guests from Montgomery County, and I hope I did not forget to name anyone. I also want to acknowledge, our student member of the board. Give him a hand, everybody. Sunil. I also want to acknowledge the Kennedy team who worked hard to help organize and make arrangements for today's events, the administrative team, our building services team, and a special shout out to Ms. Patrice Walsh who made behind the scenes magic. Let's give them acknowledgement. Thank you. I also want to remind everyone following today's assembly, we will tour our wellness center, not all of you. We'll tour our wellness center where most of you students have found solace and support. We will have lunch and conversation with Dr. Gupta and perhaps the Lieutenant Governor with a select group of invited students. And finally, the Department of Health and Human Services is here, and at lunch in the cafeteria commons, they will distribute free Narcan. So your teachers may have already given you a form, so look for them at lunch in the commons area. I also want to remind students who are using the translation devices, there's a table in the back that as you leave, remember to put them on that table as you're going out. In this country, education is both a privilege and a right. Every student in our school deserves a quality education, and every teacher, staff member, and administrator in our school aims to make sure our students receive that quality education. But we know that there are barriers that sometimes interfere with a student's ability to learn and achieve. And that's what brings us here today. We want to talk about building safe and healthy drug-free communities so that students can learn unhindered and move towards the bright futures before them. Today, we foster a conversation where we embrace our students, hear their voices, and position ourselves to better understand how we can help them to stand firmly and remain triumphant despite the challenges around you. And before I bring our member of the board to the podium, I do want to acknowledge our PTSA president, Ricky Ribeiro, who's here as well. And I want to remind Dr. Gupta that we did pull out some old yearbooks that I will carry with me in case you want to look through them. And so now I welcome Lynn Harris to the podium.
Good morning, everyone. It's very nice to see you all here. I am so appreciative of this event. Dr. Gupta, thank you so much. I love to see our alum coming back to us, whether it's teaching in our schools or working alongside us and partnering. It really just shows that Montgomery County Public Schools are and have been amazing. And I am so glad that we are here celebrating the work that this county has done around substance use prevention, destigmatizing substance use disorder, and making people aware of the real dangers around us when it comes to opioids. And a lot of that work has been, and I have to quickly acknowledge Ben Stevenson here in Montgomery County Department of Health and Human Services Harm Reduction, and team, because I've had the privilege of working alongside Ben for the past 2 years. I am a nurse by training, and I also am a public health professional by training, and I deeply believe in prevention. And so I've been with Ben's team doing Narcan administration training throughout the county. Anybody that asks, I'm happy to go. And I carry, and I hope a lot of you do as well, because the more people that know how to use Narcan, and again, it's safe, you can't get in trouble for using it, and you can't hurt anybody if you use it, the better. And so, and I do deeply appreciate the partnership that we're celebrating here is so inclusive of every element of our community partners, our volunteers, like Laura Mitchell, who I'm looking at Laura. We were together last night because the Maryland Association of Boards of Education gave her its Excellence in Education Award last night, honoring the work that she has done in Montgomery County around making sure we don't lose any more people than we've already lost. And so the Board of Education, we are so appreciative of this work. And I appreciate everybody around us who's, some of you were wondering what's all the purple about. You know, it's opioid awareness, it's substance use disorder, and it's celebration of recovery. Because one of the important things that's happening at this very school, your wellness center is doing amazing things to support students who are in recovery or want to be in recovery. And they're doing it in ways that feel safe and feel welcoming and are accessible, and that's the secret sauce. And so, but it wouldn't happen without all of these people, that with Health and Human Services, MCPS, our people in our psychological services, our counseling work, our school wellness work. Where's Damon and team? So the folks that work in school in our wellness part of MCPS, because it's 2024. It's not 1924 or even 1984, where schools just were schools. Schools were just places that teachers went to teach and students went to learn, and that was it. Our work is so much more now, because we know we have to create the conditions for everybody in our school, whatever their role, teacher, staff, student, volunteer, to be well before they can do well. And that is this work. And I am so proud of this work and the way we have acknowledged it, and this Board of Education and the school system has embraced it as not just, that's not our job, but this is now part of the job of public schools, is doing the work to make sure everybody is well. And we can't do it alone, and we're not doing it alone. We have this great partnership and all of these amazing people. And let's not forget the students who have been amazing advocates for themselves, for their peers, around opioid awareness, substance use disorder treatment. They formed state organizations, and they are boots on the ground in 2 years ago, speaking very directly that they wanted to make sure that they would not get in trouble if they carried Narcan in schools. And so, led by our medical officer, Dr. Kapunen, whom I still miss and mourn every day. We don't have that office anymore, but she made sure that the message went out to students, to staff, to administrators, that it is, you can carry Narcan. and you're not going to get in trouble. And we want to make sure you are trained, you have the knowledge, and you're empowered to recognize the signs, to act when you need to, and possibly save a life. And our students have been saving lives. So, and I do want to acknowledge another one of our county council members, Lori Ann Sales, has just joined us. I'm going to stop talking now, but again, I just cannot express how much I appreciate this work and how incredibly valuable it is, because every life matters, and we don't want to lose anymore. And so now it is my pleasure to introduce, speaking on behalf of our superintendent, our chief of schools, Dr. Peter Moran.
Good morning, everyone. This is absolutely a special day for me because as I serve you as the chief of schools in Montgomery County, I also was a part of our Kennedy cluster for 8 years as the principal right across the street at Glen Allen Elementary School. So happy to come back home and be with our Cavaliers. Good morning. I want to thank you for being here as we gather to recognize the tremendous efforts happening right here in Montgomery County to combat the opioid crisis and prevent overdoses in our community. Unfortunately, our superintendent, Dr. Thomas Taylor, cannot be with us today as he is attending the Maryland Association of Boards of Education Conference. He asked that I extend his full support and an apology for not being here in person. Dr. Taylor is, without a doubt, fully supportive of the work so many in this county have done to raise awareness of the opioid crisis and supporting the health and well-being of our students and families. I'd like to extend a warm welcome to our distinguished guests, Dr. Gupta, Director of the White House Office of National Drug Control Policy, and Lieutenant Governor Aruna Miller. Your presence underscores the critical importance of the work occurring in our community to address this public health issue. Also, it is extremely important, I know it's already been done, but I need to do it again, to recognize someone in our audience who many of you know very well. Laura Mitchell of Montgomery Goes Purple, who is an important community advocate on this issue. Could we please give her a round of applause? Ms. Mitchell has actually been recognized at the same conference Dr. Taylor is attending with the Maryland Association of Board of Education with the 2024 Excellence in Education Award. This is for her dedication to educating communities about mental health crises and substance abuse hazards. Thank you, Laura, for your service. So it is true. Montgomery County is taking important steps in this fight, thanks to the leadership of local government and the collaborative efforts of organizations across the county. Narcan is now widely available through our fire stations at no cost to the public. We are also proud to share that Montgomery County Public Schools, including right here at Kennedy High School, are making Narcan available as a part of our emergency response plans. In fact, students in our school district are allowed to carry Narcan, as Ms. Harris shared, empowering them to be part of life-saving efforts should the need arise. Lastly, we are so glad that today's event is not just about awareness, but also about important actions that can save lives. This means that we are working together so that our schools and community are safer. Thank you all again for being here and for your continued support and commitment to this important issue. With that, let me welcome to the podium our Lieutenant Governor Aruna Miller.
Well, good morning, Cavaliers. Everybody doing good? All right. Well, I don't know about all of you, but I am really curious to see what Dr. Gupta looked like when he went to high school here. So I can't wait to crack open that yearbook. I'm Aruna Miller, your Lieutenant Governor, and I want to thank each and every one of you for being here And for all the speakers you just heard from, including Board of Education member Lynn Harris and Peter Moran, thank you so much for your remarks. And I want to recognize all the many elected leaders and community activists, and again, Lori Mitchell, for the incredible work that you do here in Montgomery County. So thank you for all that you do. A great big shout out to Secretary Emily Keller from Maryland Office of Overdose Response. And Principal Adamson, thank you for hosting today's event. Now, I understand that Kennedy High School is turning 60 years old this year. That's a story to write about. Cavaliers, did you know that your principal is a novelist? How many of you know that? Yeah, that's right. She's not just running the school, she's busy writing books filled with stories. How cool is that? And you know what else is cool? That you all are home to the 2024 Olympic gold medalist, Thea LaFont. That's pretty cool. Now, what's really remarkable about Thea's story, besides the fact that she's a gold medalist, is that her story is one of resilience. It's a comeback story. She didn't make it to the finals in Rio and faced disappointment yet again in Tokyo, but she never gave up. She kept pushing, training, and believing. That's a story that shows us that setbacks aren't the end. They're just the start of a comeback. And this is true in sports, in life, and just about every aspect of our lives, and especially in fighting against addiction. Recovery is a comeback story. And one tool that can help make that possible is naloxone. It gives someone the opportunity to survive an overdose and rebuild their life for their own comeback. By learning how to use naloxone, you can be part of someone's recovery journey, giving them the hope of turning things around. You will later get a demonstration on how you can help someone experiencing an overdose and potentially saving their life. Sadly, not everyone gets the chance to turn things around. I lost my brother-in-law, Ed, to an opioid overdose. It caught me completely off guard. I was blindsided. I never saw it coming. It's been 7 years since his sudden passing, and I'm still trying to make sense of it all. I don't think I will ever forgive myself for not seeing Ed's pain. But the truth is, Ed never shared it. He kept his pain hidden, and instead of reaching out for help, he turned to drugs to numb his pain. Look, addiction isn't just about drugs. It's about pain. People who experience addiction are often carrying heavy burdens, and they don't know how to handle these burdens. The shame and stigma surrounding addiction can make it even harder for them and to reach out and seek help. That's why it's so important to show compassion. By understanding the pain behind addiction, we can break down the stigma, support those who need help, and guide them toward recovery. How many of you know someone, a friend, a neighbor, or a loved one, or have personally been affected by drug use? Just like your principal who writes stories, I'm asking you to share your story. Why? Because your story matters. When we share our experiences, we help others feel less alone. We break down the walls of shame and stigma that surround struggles like addiction, and we show others that they too can seek help and get the help that they need. Your story could be the reason someone else finds courage, to share their own. And that's how we start real change. Sadly, last year we lost 2,348 Marylanders to overdose. To put that into perspective, that's like losing every single person in your school and then some. It's scary. It's a big number. But together, we can change this. And it starts with every one of you. First, do not turn to drugs. What may seem like a quick fix can become a lifelong battle, and it can cost you your life. Second, approach life with empathy. You never know what someone else is going through, so do not judge. Be compassionate. By learning and sharing and supporting each other, you can make a real difference and help prevent future losses. Third, if you or someone you care about is struggling, please call or text 988, the Suicide and Crises Lifeline. And remember, if you are ever with someone experiencing an overdose, the Maryland Good Samaritan law protects you and the person overdosing from being arrested, charged, or prosecuted for drug possession when you call for help. And finally, learn the signs of overdose and how to use naloxone to save someone's life. Governor Moore and I want to remind you that heroes aren't just on television and movie screens or in fictional stories. They are real, and they are you. You have the power to make a real difference in your community and the lives of those around you. And today, we are honored to have a real-life hero with us, someone who walked these very halls as a Kennedy student just like you, someone who is a big deal, just like you will be. So Cavaliers, let's make some noise and give a warm welcome home to the Director of the White House Office of National Drug Control Policy, Dr. Rahul Gupta.
Good morning, everybody. Thank you, Lieutenant Governor Miller. Let me just start, first of all, by saying that you in Maryland have the most amazing lieutenant governor and governor across the whole country. Let's give him a round of applause. Now, let me first start with the important part, which is congratulating you guys on beating Northwood during the homecoming games last week. Go Cavs! You know, it really feels great to be back here at Kennedy. I was a student here way back in the mid-'80s, so before that, I went to what's now called Odessa Shannon Middle School. There you go. And before that, I was at Arcola Elementary School. So I know that Kennedy is no stranger to diversity, to multi-ethnicity, to a variety of opinions and thoughts. I'm originally from India, and I will tell you that I was here for a few years, and my father's assignment ended before I could finish, and we moved back to the United States in 1996. So let me first start by thanking Principal Adamson. Not more can be said about how important her leadership is here and the district leaders who have invited me. So all of the guests, Secretary Keller, and all of the folks, including Carla Silvestre, Dr. Taylor, and thank you for all of you for inviting us back here. Thank you so much. Now, let me start by asking, how many of you are a senior? Raise your hands. How about a junior? all right? Sophomore, and a freshman. All right, we seem like we got a very good even keel split. Now, it's been decades since I've been in your seats here and walked the halls. And most of the memories here for me are pretty good ones. Let me tell you, I ran cross country. I was on track and field team, but obviously not as successful as Thea LaFond. And I remember how the coaches made us made us not to eat fried foods on lunch just before our meet days, and how much time we spent on the buses here waiting to go. Look, the school was as diverse then as it is now. We had a lot of students, as we have now, who were multilingual and multi-ethnic. You know, the important part when I hear about our counselors and the work that's done by our principal, by our leadership, I've been part of that. And I can tell you, like many of you, that when you grow up, when you're in this stage, you go through challenges. I was one of those people that was going through challenges. And my counselor, Mr. Raymond Constantino at the time, just did magical things to help me. That now I can see now looking back how important that was to have a level of support. So I know that the sense of community and the sense of family that you see here, you experience here with your colleagues, with your teachers and counselors, is really what's important and what's so special about Kennedy. Of course, let me just also say that I lived in Wheaton on Blue Ridge Avenue. There you go. And look, I'll be frank here. I was offered drugs a number of times. And that would happen on the bike trails, that would happen on streets in front of pharmacy. A number of times I even knew the people. But something in me decided not to take them up on the offer, as the Lieutenant Governor said. That was so fortunate for me. And I know not everybody's always in the same place. But that little decision that you make at that time, no matter what's going on in your life, makes a big difference afterwards. It did for me. So I do appreciate the opportunity at that time to have that decision. But let me just say, most schools across America face that same challenge. We can move on to the next slide. And it was true being offered drugs on the streets in the 80s when I was in school. It was also true when my kids were in high school recently in West Virginia. And probably that's not going to change anytime soon. You know, your ability or your risk of being exposed to drugs. But you know what has changed? What has changed since my time is that drugs have gotten much, much lethal, much more dangerous than ever. When I was a student, I'd be offered like weed, maybe, right, on the streets. Today, people are going online and they're trying to sell you what we call fake pills, right? So if you're thinking that, hey, I might need to stay up for exams, I want to have some Adderall, I want to help get sleep, Xanax or Oxycontin or something like that, just know that when you order things online, the likelihood is 7 out of 10, 70%. That's actually going to be a fake pill that's going to have deadly fentanyl in it. You take it, you may not wake up. So fentanyl is this drug that's not only being added to cocaine and meth and heroin and others, but you know, it's very important. It's very dangerous. One that I didn't have to deal with, but now you have to. And fentanyl really doesn't care who you are, where you live, what you do, what you look like. It just is such a dangerous and deadly drug. And I can tell you, we talk about our experiences. Yesterday we had at the White House experience shared by Robert De Niro. You know Robert De Niro? All right. His grandson died. We had experiences shared by Samuel L. Jackson, who himself had suffered from this. So what I'm saying is, look, of the 100,000 people each year that die, there's so many empty seats at night at the table. So many of those families are being torn apart, communities are being torn apart. And let me just tell you, I've been working on this crisis as a doctor for so long, right? And I've known so many people who've been addicted to drugs. I've also known so many who have lost their lives. You can't treat dead people. You can't help dead people. And that's why, let me tell you a very story quickly. When I was practicing full time, I would do an emergency room and I would see patients. And I had one patient that he would come in at least once a month, oftentimes overdosed, in trouble. He had diabetes, he had other problems, kidney disease, but he'd come overdosed. And I would fix him, and I would know him so well. And I would tell him every time, try to quit, wouldn't listen, but we would treat him again. And one time, I come into my hospital next day for rounds, and I had this team with me, right? Residents, students, all of those. And they said, well, we admitted to John Doe. And this person is like totally obtunded on a ventilator in ICU, the whole bare chest and everything. And they're trying to sort of make him survive, save his life, almost died. And I look at his chest, and I look at the tattoo on the chest. It said, the chosen one. And I was like, that's not John Doe, that's my patient. Because I knew the patient because of his tattoos. You get to know people, right? It's an intimate environment. We're trying to help people. And we saved him, but that was the experience it took for him to quit his drugs. That was what got him into recovery. But, again, when I heard about the challenge in my own high school with overdoses, it really hit close to home. And it's intimate for me. It's something that's close to me. And there's so many people that have passed away, both across the state, in this county itself, and across the country. So I'd like to hold a moment of silence for those who have lost, either as part of Kennedy High School family or in the community. So please join me in a moment of silence. Thank you. Look, it's a hard topic to talk about because of stigma. And when I went to medical school, we didn't know that addiction is a disease. It's a disease that affects you. That means that you can get help, and it can affect anybody. And recently, the Vice President of the United States put it best. She said, these are countless people in our country who are suffering right now because of the epidemic. All of us have to address it, but we must destigmatize this issue. We must remove judgment from the issue, just like the Lieutenant Governor said today. And we must treat it as a healthcare issue that it is. So I'm glad that our country is finally starting to treat addiction as a disease. And I will tell you, President Biden, my boss, has made treatment more available, made naloxone, the antidote for overdose from fentanyl, like drugs, more available. And we're trying to get people help to get into recovery, treatment and recovery. And this is what we're talking about. This is naloxone. And it's really important. You heard today how it's available for you, and you don't get in trouble for carrying it. It's really important. And Principal Adams told me that any student who needs Narcan or naloxone now can stop by the Wellness Center and pick it up right after assembly. We're just 2 weeks into October, which is the National Youth Substance Use Prevention Month. And when we highlight the important work that is happening across for young people. Now, I know we have so many great student leaders on this campus who are working to build a safer community, including Rosemary Soul, who's here today. Rosemary, where are you? I know you're here somewhere. All right. Well, let me tell you, at the White House, we run a program. It's called Drug-Free Communities Coalition. We can move to the next slide. And our DFC program really provides funding to community leaders and coalitions for preventing youth drug use. And I could tell you that this is the kind of work we need to be doing more and more. And we have our leader, Helen Hernandez, you can reach out to. But every one of you, I can tell you now, having sat in your seat, you have the power to make the change. You have the power to influence others. your friends, your family, to make sure they're staying out of drugs, and if they are, they can get help. Really important. And then you also have the power to become a hero. A hero that, if nothing else, you're going to save a stranger's life. Someone you won't even know, but you'll save their life because you're going to be carrying one of these with you. Now, I will tell you, the government's also working to go after traffickers. And I told you that, that at least 7 out of 10 of these pills are dangerous. But I'm not here to scare you. Let me be very clear about that. This is not about scaring. This is about warning you how dangerous fentanyl is and how to make sure that how you can be a part of that important solution. That's why we're all, like all the adults here, us, like gathered here, because you are the solution. You are the power. You have the power in you to actually help other people. Now, we're also running social media campaigns, because in my time, I sat in the classroom and we rolled in that roller with the film, and we learned about drugs, we learned about pregnancy, and we learned about all those things. It was impactful. But we realized that now we got to go to social media, because that's where you all are. So we've got a campaign on Snapchat. Let's see if we can play this, show you guys. Great. All right, so has anyone seen this before, by the way? Raise your hand if you have. A few hands, okay. So we're doing this. We also have something called the Real Deal on Fentanyl. If you could look up, the Real Deal on Fentanyl is another one that's got 2 billion impressions already. But we've got it in Spanish and English. And we're doing this because, look, I've met so many parents and brothers and sisters who have lost a family member to overdose, and they always say, what can we do more? You know, in 2022, for example, we lost nearly 100 young people a month. That's 3 people lost each and every day. And you know what? Every one of these deaths were preventable, every single one. So the question comes up for us is like, what can we do? And when you look at the data, in all of these numbers, in 2 out of 3 situations, there were bystanders nearby, but no naloxone, no antidote. So we're trying to change that, and with your help, I think we can change that. And let me show you right now, how do you use this naloxone that we've been talking about, okay? It's really simple. So I'm gonna walk over and demonstrate for you. So let's call this dummy Omar, okay? So if you see someone laying around that you can't see if they're responsive or they're sick or not, the first thing you got to do is, touch Omar, make sure it's moving. If not, then you're going to look at the skin. If the lips and fingers and all look blue, that means maybe there's not breathing happening. Skin looks pale. You look in the eyes, the pupils might look very small. That shows you that maybe it's an opioid emergency. In either case, you try to wake up the person. They won't wake up. And the next thing then you have to do is call 911. Okay? If you have someone else, tell them to call 911. While you do that, it's real simple. Then you take this. It's usually in a package. You peel the package off. This is what you will see. Okay? This is going to be naloxone spray. Now, the way you hold it is you put 2 fingers like this, and your thumb goes here. Now, what you don't want to do is test it like this. You don't want to do that, because then the drug or medicine will go away. It's only 1 shot, 1 time. So you want to go like this, And then what you want to do is straighten the head this way, and you go into one of the nostrils like this. Let me make it this easy. And you go and insert all the way in till your fingers touch the nostril of the person in one. And you push this red plunger in. That way, all the medicine goes in. At that point, you will take that person, you will put them on their side, and if possible, you can put their arms underneath so they don't turn over, and you wait. Now, you can wait for about 2 to 4 minutes for them to wake up. If they haven't, then you can always do the second dose, because most of these will come with 2 doses if they don't wake up. Then you use the second dose. Otherwise, they will usually wake up. They might be a little irritable, but remember to also call 911 at the same time. That's as simple as it gets. It's like literally using Flonase. That's it. Okay? Let me walk back now. Any questions? So now we're also going to have a demonstration in Spanish. So let's hit play on that. So we saw that we created this kind of the ad with Ad Council for you all to make sure that it's as simple as just carrying it. And I'll tell you, I've seen people that I've been able to use it on. I've, of course, used it in emergency rooms so many times. It's not a hard thing. And listen, you would never know that you are the difference between life and death for someone, and they will be thankful forever to you. Now, earlier this year, we started the White House Challenge to save lives from overdose, which means that we wanted to get more of this out there in businesses, in school systems, in other places. And I know Montgomery County Public Schools has been such a leader in this effort. And I want to first of all thank MCPS for joining our challenge, and really thank Principal Adamson and Kennedy High School, because it's really important that your teachers, your staff, and students are trained and they're taking it seriously, because that's what our country needs. Look, this is a wonderful, wonderful, wonderful county to live in. I've obviously grown up here, and I think it's important to be part of that solution. So remember, when you get this, it's important to keep it with you wherever you go. I carry it in my bag. Now, before I take questions, and please go ahead and write your questions. I really like it. No question is a dumb question. Anything, and you're not going to be named, so please pass those on. I want to mention one thing, and the Lieutenant Governor talked about this a little bit, which is in Maryland, when you see someone overdosing, whether or not you have naloxone, first of all, please call 911. Call 911 right away. But you cannot get in trouble for calling 911 when someone is overdosing, even if you have drugs on you. Really important to know. Even if you have used drugs, even if you have drugs on you, and you call 911 for someone else who's overdosing or dying, you cannot get in trouble. And that's thanks to something called the Good Samaritan Law, and it exists because saving lives is more important than arresting people for having drugs. And as I said earlier, if you need naloxone for yourself, your family, or your friends, you can get it right here at this school. Please carry it with you, because you never know when you're going to find someone else that needs your help. So thank you for being such a great audience. I'm looking forward to both answering the questions you might have, as well as touring and seeing the Wellness Center and so much more today. So. Thank you. Waiting for some questions to come. Yeah, so look, in some people, first of all, remember, this only works for opioids, fentanyl, heroin, those Oxycontin. It doesn't work if you're sedated because of alcohol or Ativan or Xanax. And there's some other dangerous drugs out there too. But oftentimes it's a combination of different drugs that's in the system. So if the second dose doesn't work, you should try to give a third dose. But understand that at that point that there may be more than just fentanyl in the system. So it's important, that's why, to call 911, because they can get the oxygen support and other support that person needs still to save their life. Because those precious minutes that go by is when the damage to the brain is happening and damage to the heart and your vital organs is happening. Got some questions?
Thank you. Here's our first question. What will you do to stop the selling of drugs?
A great question. So look, when we began in the administration 2021, it was very important to look at both sides of the coin, right? There's two sides of the coin. One is getting people the help that we've been talking about today and get them as quickly as possible. The other one is people who are up to no good, preying on vulnerable people. And we've got to make sure that what we are doing now is looking at this as a commerce, as a business. Before, the way was, let's lock everybody up and throw away the keys. Well, that hasn't worked. So now what we're trying to do is make sure we go smartly after that. So we're working to disrupt that commerce, that business, by making it more difficult to profit from selling drugs. So we're working all the way from the government of China and Mexico to all these illicit companies by sanctioning them and taking actions, including the cartels, and also throughout all the way. So it becomes more expensive, it's not a business proposition anymore to try to sell. Now that's gonna take time, and that's still going on, but we have seen improvements. We have seen, the latest data shows 10% decline in overdose deaths, which is great, but we got so much more work to do, but it's two sides of the same coin. On one hand, going after making sure the real criminals are in trouble, not people who suffer from addiction and just need help, and then helping folks who need the help.
Here's another question, and then we might take a couple of more before we end. So when did addiction start to be treated as a disease, and how did people realize that it was a disease?
That's another great question. Look, when I went to medical school, we didn't even know about how the brain mechanisms work and all of this. So science wasn't there. When the science isn't there for anything, people make things up, right? So people thought at that point, well, it's a choice. Well, it may be a choice the first time, the second time. But what we have learned over, let's say, last 20, 25 years is that it's actually a disease, and the pathways for addiction are kind of same like for gambling, for alcohol use, for eating disorders. A lot of those pathways, because what happens is when you use drugs or what have you, it gives you a chemical called dopamine. And dopamine makes you feel good. Now, you can also get dopamine by having good friends, having community, doing what you love to do. So it's a matter of how do you shift yourself to get dopamine, the feel-good chemical, but you don't have to do drugs. You don't have to do any of those other things. You can do a lot of other activities like physical activity, like having, again, community and other things. So we've learned this now. So it's very important now to understand that, disrupt the cycle in the brain by helping people treat addiction as a disease, and then get them back into society in lifelong recovery. So all of these things are important because now we understand science so much more, and we've got to take advantage and help people as we know science is.
This next question, how can I get naloxone being a minor?
Well, I would say right here, come to the Wellness Center. And as we've been saying, you are not going to get in trouble for carrying naloxone. Naloxone is also a very safe medicine. Not only is it life-saving, but it's very safe. So let's just say our friend here, Omar, was not going through withdrawal. It was something else. Well, it's not going to hurt giving naloxone. So it's actually very, very safe medication to use in case it's something else. But there's no restrictions on that, and that's why the school really encourages you to carry naloxone.
Here's a question that says, what are some good career pathways for drug abuse prevention?
Wonderful. That's a really good question again. There's so much you can do, right? We know that undergrad in public health is one of the highest moving forward undergrad areas for college. There's so much in technical education you can also do. Addiction counseling is another one. Social work area is another one still. There's so many pathways for a career side of this that's opening up. So no matter what your interest is, something will be available. Now, if you're more interested, please reach out to the wonderful principal you have, and we can definitely connect and get you all the resources on that, because we're very excited when you're thinking about your career pathways, and we want to help you get you all the options that are possible.
Okay, I have two more questions. This one says, what can we do other than carry around Narcan?
Yeah, so I think that's another one that, what can you do beyond carrying it around, having trained in it, know how to use it? Well, the most important tool you have, even more important than carrying naloxone, is to take your position as youth leaders, where you are right now, and make sure when someone next to you, like I did, you might think is having problems or having trouble or may need some assistance, provide that community. Provide that community to your colleagues, to your friends, to your neighbors. So make sure that you can prevent it from happening in the first place. And oftentimes, you'll have folks who are friends to you and they may not be talking the same way. Maybe there's something else going on at home or in class or elsewhere. Talk to them. Reach out. Make sure that no one's excluded, no one's left alone and left aside. Sometimes that little reaching out can be life-saving in the sense that it can prevent them from taking that next step of using drugs or being offered drugs. So just make sure you're being inclusive and taking care, as the Lieutenant Governor said, being empathetic and taking care of the person next to you. It's really important, especially in the time of social media that we're dealing with today.
And here's our final question. What would you say is the biggest challenge in the process of recovery?
Oh, wow. That's a really great question. Look, everyone has their own recovery journey, and the challenges could be different. I've heard from people whose biggest challenge were that they were living in the same area, and until they changed, they couldn't really change. There are others for whom it was having an economic opportunity, getting a job, until they felt like they had a purpose, higher purpose, that was a big thing. Mostly recovery, look, it's about your personal health. It's about your home, rebuilding relationship. It's about your community, rebuilding relationship in your community. And it's also about finding a purpose, a sense of purpose in life. And those are 4 areas that if you could cover, then that helps having it. And one of the important things about that is finding peers, finding others in recovery who can be there for you. And that's one of the things we're trying to do, is we're trying to create these recovery-ready businesses that we form a recovery-ready nation. So when you're looking for a job, your employer already understands that people in recovery are some of the hardest working, most committed, and dedicated people you will ever find. And you know how I know that? Because we've got people in White House in recovery that are working for us. And we trust them 100%, and they're such dedicated employees. So the biggest thing that you will find is you got to find your own North Star and find others who can help you get there and stay there. Thank you.
Let's give a wonderful round of applause for Dr. Gupta.
Thank you all. Appreciate you.